The health plan's reaction to my well-insured son situation was also stunning. It just wasn't positive. And so the paradoxes, the paradoxes of the US healthcare system came quite clear to us at that point. And we started looking at it and we said, you know, the incentives in this system, if you can call it one, I actually agree with Denny, it's not a system at all. The incentives are all messed up. And so we said, well, let's write about that. So we wrote a piece about the skewed incentives in the US healthcare system. And a decade later, looking at that, we said, you know what, these incentives are not just skewed, they're completely resistant to change. Now, it took us a decade to get back to that, because in the intervening time, my youngest son had a chronic disease. It was very painful on a daily basis. He was up 8 to 20 times a night, which means I was up 8 to 20 times a night. And for 6 years, we were unable to find anyone who could diagnose it. We finally got a diagnosis, and the good news is it's amazing how fast a human body heals with a correct diagnosis and appropriate treatment. And I now have 2 completely healthy kids doing well by any standard. And it was on that energy, that phenomenal energy, that we wrote this book. It was in the wake of having 2 well kids that I had the energy and the wherewithal to think about the incredible puzzles in the US healthcare and what it would take to get a system that worked better. You know, the intellectual puzzle about the skewed incentives was where we started, but when we looked at it again 10 years later and said, wait a second, these incentives are so incredibly resistant to change, we concluded that the problem wasn't the nature of health or the nature of healthcare or the existence of insurance, that the problem was competition. Now, I'll explain what I mean by that. That's an odd conclusion for a couple of business school professors to reach, but it is the conclusion we reached, and I'll explain what I mean by that as I go along. Because it wasn't too much competition or too little competition, but the nature of competition. Step back with me for just a minute and think about this. When you think about competition in the rest of your life, here's what you see. You usually see quality improving and efficiency improving simultaneously. If you go to buy the same computer that you bought a few years ago, it would either be a lot cheaper if you bought the same one, or if you wanted to spend the same amount, it would do a lot more. You expect to see efficiency and quality improve over time. And when value is improving in that way, you don't see people wringing their hands. You see people wringing their hands over the percentage of GDP spent on mobile communications? No. Do you see people wringing their hands over the percentage of GDP spent on information technology? You don't. And you don't because value is improving. And when value is improving, we're not necessarily bothered even by increased spending. We spend more on computers. We spend more on mobile communications. We spend more on information technology than we did 10 years ago. But value is improving. We're getting more for those expenditures. And so the puzzle that Mike and I wanted to address was, how could you change what's going on in the health sector so that you could drive improvement in quality and efficiency simultaneously, drive it, not just allow it, but drive it in a way that allows us to have better health and better health care for all Americans. So that's the question we started with, and it is a compelling